بسم الله الرحمن الرحيم. السلام عليكم. اليوم محاضرتنا لهذا اليوم هو Schizophrenia Spectrum and Other Psychotic Disorder. Learning Objective Introduction defines schizophrenia, differentiated between positive and negative strain schizophrenia in new DSM-5 كان سابقا بالDSM-4 فقط schizophrenia and other psychotic disorder. Identify two other psychotic disorder, identify causes of schizophrenia, identify treatment models for people with schizophrenia, identify nursing care for people with schizophrenia. Historical of schizophrenia. Karplin named it dementia precox. Lawyer names schizophrenia split schizophrenia mind. Identify 4A disturbance for effect, loneliness of association, autistic thinking and imbalance. Called the first rank psychosis, delusion, and second rank all other experience. Definition: schizophrenia is psychotic disorder or a group of disorder marked by severe impairment thinking, emotional and behaviors. Schizophrenia patients are typically unable to filter sensory stimuli and may be enhanced perceptions of sound, color and other features of their environment. Continue. Most schizophrenia is, if any, treated gradually, withdraw from interaction with other people and lose their ability to take care, personal need and grooming. People with schizophrenia have split between their thought and their feeling and between their reality and society reality, which can lead to unusual and frightening behavior. Schizophrenia is frequent causes for long psychiatric hospitalization. Continue. The first psychosis break often respond well to treatment, but the relapse rate is high and the person may become increasingly disabled. Continue. DSM-5, a new category, schizophrenia, under the global title of the Schizophrenia Spectrum Disorder 2030. In the past, schizophrenia was divided into 5 subtypes of catatonia: delusion, disorganized, undifferentiated, and residual. But in 2030 these were eliminated. يعني السبتايب السكيزوفرينيا بالدي اس ام 5 نقول عليها هي الجود باي، يعني eliminated، انشالت او ازيلت من التصنيف. The new term of schizophrenia spectrum disorder reflected the gradient of psychopathological that patient can experience from least to most severe. A disorder such as schizophrenia, form disorder, and schizoaffective would be these severe forms. Epidemiology. The schizophrenia affected men slightly more often than women. In men, our diagnosis is usually between 16 to 25 years, while women in age 25 35 years, estrogen may be protective in women. Approximately 7 and 8 individuals out of 1,000 will have schizophrenia in their lifetime, almost treatable with the medication. Suicidal 20 suicidal 2050 attempt 10% complete. These categories the schizophrenia according to the DSM-5 brief psychotic disorder less than 1 month, schizophrenia form disorder 1 6 months, schizophrenia greater than 6 months, schizoaffective disorder or substance drug induced psychotic disorder with psychotic disorder due to a medical condition with catatonia, other specified schizophrenia spectrum and other psychotic disorder. In specified schizophrenia spectrum and other psychotic disorder. The former symptom group of schizophrenia: A. Positive or hard symptom. It focus on distortion. هذا اللي نقصده هو البوزيتيف or hard symptom. Distortion of normal functions. The positive symptom usually appears early in the illness, and their dramatical nature capture or the attention and often precipitated hospitalization. It includes the following symptom: delusion, والhallucination, والambivalence, والpositive or hard symptom, disorganized speech, association lostness, والecho-layla, والneologism, والpressure of speech, والperseveration. In negative symptom, it focus on a loss of normal function, included the following symptom: logia, anhedonia, log ovulation, flat effect, thought blocking. The cognitive symptom, it includes the following symptom: inattention, easily distracted, impaired memory, poor problem solving skills, poor decision making, logical thinking, impairment judgment. The affective symptoms influence emotional and their explanation such as dysphoria, suicidal, hopelessness. Schizophrenia diagnosis: hallucination with delusion, with disorganized, at least one of these symptoms should be present. Crossed disorganized catatonia behavior with negative symptom, and at least two symptoms must be present for the majority duration. The etiology of schizophrenia: no single causes has been identified, but it is known that schizophrenia is brain disorder. Disruption of neurotransmitters, including the dopamine, has been identified. Some dysfunction in neuron function has also been found. The etiology of schizophrenia with genetic factors: if one parent has schizophrenia, 50% chance in their sibling to develop disorder. If both parents, 46%. If one sibling, 10%. Monozygote twins, 50%. Dizygote 24, 10, 15%. Neuroanatomical brain structure factors: a large ventricle due to the brain cell loss, atrophy, hippocampus and paracampus. Etiology of schizophrenia: neurochemical brain activities factors: abnormalities of dopamine metabolism, excessive level of dopamine, immunofactors, exposure to virus or the body immune response to virus could alter the brain physiological of people with schizophrenia. Infection in pregnant women as possible origin for schizophrenia. High rates of schizophrenia among children born in crowded area and cold weather. Treatment of schizophrenia, psychosocial therapy, psychotherapy, medication with psychosocial intervention, social skill training, group therapy, family therapy, and educate family about causes, symptoms, and signs of relapse. Cognitive behavior therapy, recognize and challenge delusion belief. Cognitive enhancement therapy, improve attention, memory, problem solving. In medication, first generation antipsychotic medication نسميه neuroleptics medication, chlorpromazine, largectils, reduce agitation, violence behavior, block dopamine receptor, little effective on negative symptoms. Second generation antipsychotic هو كلورازال أو الكلوزيرال أو كلوزيبان كلوزيرال impacts serotonin receptors. New medication may be improve cognitive functions. Lozapam, Zibrax, Risperidol or Risperidral. Nursing intervention for the client with schizophrenia, promoting safety of client and other, and the right to previous engagement. Establishing therapy relationship by established trust. Using therapeutic communication, explain a procedure and try to be sure the client understands the procedure before trying them out. Encourage the client to talk with you, but do not pry for information. Do not make a promise that you cannot keep. Give positive feedback for client success. Interact with the client on the basis for real thinking. Thank you for listening.